Welcome to Pedro Adorno's Expert Insights. This episode, we welcome Jim Matney, President and CEO of Colquitt Regional Health System.
What does it take for a small rural hospital to transform into one of the most respected rural healthcare systems in the country? Welcome to Expert Insights. I'm your host, Pedro Adorno, and this is where we discuss healthcare, medtech, business, and sales. The guest on this podcast is Jim Matney, President and CEO of Colquitt Regional Healthcare System in Moultrie, Georgia. Under his leadership, Colquitt has grown from a 99-bed hospital into a 155-bed teaching health system, launched multiple physician residency programs, expanded advanced service lines, and earned national recognition for patient safety and leadership. Mr. Matney was named Georgia Community Hospital CEO of the Year and also received Georgia Hospital Association's W. Daniel Barker Leadership Award for his impact on rural healthcare. In this conversation, Jim shares why CEOs should always make time for vendors, which I love. He also shares why you can't just surgically cut your way to success. He shares his secrets on how he recruits physicians into rural America, and probably most importantly, the leadership principles that have driven Colquitt's growth for the last 15 years. So this podcast is packed with valuable insights for everyone in healthcare. Let's get into it.
You know, I had a brother-in-law and a sister-in-law that were both drug reps, and they kind of educated me that sometimes they just got to get in to see the C-suite to get that one check box that some vice president set as a goal that quarter. And so I think every CEO should have a few minutes to spare. Sometimes you got to do a quick meeting and follow up with a longer meeting if you're interested. But I don't think, I think that probably one of my successes is availability. And I learn a lot by making myself available. But just think about it, if you start cutting certain segments of your information train out, what are you going to miss?
Yeah.
I wouldn't have known about Mako when we started on the Mako route had we not had the introductory call.
That's right. I
And
think that
now
was 2020.
And that's put us at a competitive edge against all of our other orthopods in the market.
Yeah. One of the first hospitals in the state to get your orthopedic robot, to get any orthopedic robot. And I remember that. I'll never forget that.
I think it's coming on the vendor to be precise and, making sure that you chit chat for 30 seconds, but then you go right straight to the point and see if they're interested.
Yeah. Yeah, a warm introduction, but don't leave it there, because salespeople can talk. But I'll never forget what you said. It was, how am I supposed to get to know about what's available, what's out there, where the market's headed, something to that extent, if I don't take the time to meet with you guys? So one, as a vendor, love that, and I'm sure a lot of vendors love hearing that. But two is, how do you make the time? As a leader, you're juggling so many balls. Is there any theories that you have or philosophies that you have around a leader creating time?
Years ago, I had several people tell me, it's hard to get in to see you. I can never get in to see you. And, you'd ask somebody, why didn't you update me on this? They said, because I can't get on it. So I have a special way of doing it. I block 4 p.m. out every day for my reading time or those last minute meetings that somebody just needs to pop their head in. So lots of times I'll tell people I don't schedule meetings during that time, but if you want to do it at 4, I can do it. So if I'm talking to you at a conference, or if I'm talking to you on the phone and you say, hey, can we set up a meeting? I know my 4 p.m. is free. And what that also does is work-life balance. It allows me to finish up my day so I'm out at an appropriate time. But if you schedule meetings all the way to 5, you've got paperwork you got to get done. So I block 4 p.m. every day out.
If you've made it this far, go ahead and click subscribe now so you do not miss the next one. And if you or a friend want help breaking into medical sales, the best place to go is medsalesblueprint.com. So that's good. So sticking on the leadership point. So you've been running Colquitt for over a dozen years now, and 15 years now. And you've been recognized, your facility has been recognized for excellence officially and unofficially. What is your advice to others who want to become leaders? What have you learned in the years of, I know actually you were a leader prior to being at Colquitt. What are your philosophies around leadership and running large organizations?
When I was 26, I got the CFO of the Year award for Hospital Corporation of America.
Mm,
Uh, my philosophy, and it's a real simple philosophy, is the fact that organizations succeed based on the team, they fail based on the leader. So the leader, in other words, if you got a bad leader, you're going to fail whether no matter what kind of team you got. But if you've got a really good team and you can lead them well, then you can be successful. But you have to really look at the team, and sometimes people aren't in the right place. I
right.
remember I had one person that basically wasn't in their right job. That don't mean you have to get rid of them. And the go-to is always this person's not performing. But if you earn yourself a reputation for trying to take an inventory of your team and figure out where their strengths and weaknesses are, and then let them kind of explore that themselves, lots of times they'll tell you what their strengths and weaknesses are, which, it's hard to be evaluating yourself. So my secret is to kind of formulate in the first 6 months to a year a good inventory of what their skill sets are, and then I just start running with it. Like I've got my VP of operations who's very good at numbers. He's a pharmacist, and he could take a spreadsheet and turn it into something great. So I give him market share data. So I actually let him run with the market share data. He's also a detailed person that can take a department that maybe is missing their goals, and he can peel that onion back a lot. He can just sit there and peel it back to whether it's the referral sources, the doctor. He does that a lot with data. Versus I've got somebody else that really is big at just you give them the vision and they want to run with it. So
Yeah.
I think the mistake a lot of leaders do is they try to be the same across the whole organization. But organization behaviors, and you've been around a lot of people. Different people react and function differently. So I think the key to good leadership is recognizing the different skills that everybody has, the different skills that you have. Like, for example, I'm an old CPA, and I started out as a certified public accountant. So I'm very good at numbers. I'm very good at figuring out financial stuff.
Yeah.
So I talk that language, but if you try to get me to take that one department that I gave to my COO and peel back that onion, that wouldn't be a skill set that I'd have. I just don't have the patience to sit there and
Yeah.
uh, peel the onion back.
So it sounds like knowing strengths, recognizing your own strengths, recognizing the strengths in others and taking advantage of them. I've I've met with your CFO, Julie, who's been there for, I think she said 14 years. I've met with your facilities team. They've been there for a while and they all take pride in it. And what I'm saying here is when it comes to a rural facility, from the outside looking in, rural facilities, rural hospitals, are struggling. They're getting bought out financially, trying to make things happen. But when I look at your site, maybe it's just the way I'm looking at it, but it seems like y'all are taking advantage of the benefits of being rural, of like having a community, right? And people aren't jumping around all over the place. I think it speaks to your leadership and taking advantage of what you have. Like you just explained, you have employees doing things that might not be in the roles and responsibilities of that role, but it's the benefit, the whole picture. Do you feel like you have a team that sees the big picture and everybody's just helping out the facility as a whole, the healthcare system, the community?
I think I do, but I think I figured out what causes different organizations to thrive and what don't.
Okay.
Yeah. I liken it to the fact that uh, you can't save yourself to success. When things are tight, you can cut costs, you can cut expenditures, and you can do all that. And that's kind of lots of times the role of the CFO is to make sure expenses are in there. But if you don't have a growth strategy, in other words, you got to be able to grow it, and that's the problem with rural hospitals. is they like, for example, the Mako robot. Most most hospitals would say, I don't have that type of money to add that modality to it. Well, if you think about the orthopods that are coming out, they've probably all been trained on Mako. So what's your chances of recruiting another orthopod or growing that service line if you don't buy the technology and get in there? So the difference between my hospital and all those other rural hospitals, I always like to say we're a rural hospital on steroids, is that the growth strategy supersedes the expense strategy. You got to have
Right.
it both, but you really have to sit out there and think, how am I going to grow this volume next year? What new service am I going to offer? How am I going to take it from point A to point B? And most people look at it from the expense side. Uh, I kind of like to make sure
Yeah.
you got a balance of it. So, and
That's
I
great.
don't give a lot of people the authority to make decisions that could affect the vision of the hospital. And I do think this is part of the problem with organizations is chief financial officer, we're going back to their skill sets. One of their roles is to make sure expenses are right, the staffing's right, making sure that you don't buy too much in supplies. Well, if you think about that, if you allow that person to make organizational decisions, they're probably going to say, we can't afford it. So the big organizational decisions, and sounds very egotistical, has to rest with one person.
Right.
Somebody's got to have the big vision, and you still got to make sure that that one component's doing their job, but you can't let them have the decision that kind of overrides their area of expertise. In other words, you got to keep them in their lane. Uh,
Right.
you got to keep a chief financial officer in the lane. You got to keep your nursing officer in their lane, making sure that they're staffing appropriately and they're providing good quality. But for God's sakes, don't let them overstaff.
I love that. I love that. That's probably something you won't hear a lot, right? Because it's an uncomfortable truth. But those are what you're talking about right there. Those are the tough decisions that leaders have to make, because there's times when you want to allow people the freedom to make a decision and be creative, but the buck stops somewhere, right? Because there's
You allow them to make decisions where their lane is,
Mhm.
but don't let them make a decision that affects the whole organization without your consent. And I always study the three branches of government, and I always think about the president. There's a reason there's a president that was elected. He makes a lot of decisions. People bring to him, and a lot of times they'll bring him what the pros and cons of a decision, but ultimately he's got to make it. Well, I think that's a good history, and it's worked historically for 250 years. But somebody has to make a decision. But a CEO that absolutely delegates that authority to parts of the organization has given up what the
Mm.
vision is.
So be careful what you're delegating out.
Yeah.
Yeah.
Don't let
Because
them run with it. Don't let them run with it. And is it micromanagement? I do think it is micromanaging, but you know, I don't think I think there's more upside to micromanaging than there is downside.
yeah, tough decisions do need to be made. I think that's a great example. You let people give you the reasons why and why not, and then there's one person who's been elected or appointed the role of to make the decisions, and you go right ahead and do it.
You know, the
Um,
best example was during COVID. Uh, I had the chief medical officer making decisions and sending out directives for the doctors to make sure they're wearing masks, make sure they're doing all this. I had the chief nursing officer, and finally, 2 weeks into the epidemic where people were getting sick, I said, there's too many people making decisions. So at 7 o'clock in the morning, at 4 o'clock in the morning, we're going to all come together. We're going to make a decision and we're all going to stick with it. But that's to me, one of the failures of organization is there's too many branches in there making decisions that affect the organization. Now you're going to give them the authority to make a decision in their nursing department. You might give them their and I always say stay in your lane. You give them the authority to make it in the lane, but then if it's a decision that kind of gets out of their lane, pull them back a little bit and say, "Hey, talk to me about why you're doing that."
Hmm.
The famous comment people make to me is, "Jim, why can't I make this decision?" Well, I said, "You can, but your decision's affecting other people, and somebody needs to be able to make sure that what you decide's not going to hurt the other part of the organization."
Yeah. As an employee, people need that. People need to know where their boundaries are as well. That's even if at one point you might not like it, at the same time, to not understand what you can and can't do is a problem. And what you're saying is just like so many people have dealt with, where one minute you think this is allowed, but then you hear it's not allowed. And then you're like, what do you want me to do? And then people just kind of give up if they feel like there's too many, well, I don't want to get in trouble, or I'm tired of spinning my wheels here. So somebody does have to kind of lay the law down, so to speak. And it doesn't have to be negative, to your point. It's just like somebody has to,
Somebody's gotta be the coach.
yeah,
If you think about that Friday night football, the coach has got a offensive line coordinator and all of it. Somebody's ultimately got to be the coach. And I think that's the true scenario of a good functioning organization is that the leader, the CEO functions as a coach. He hears all of it and finally he's going to be the one to pull that last trigger. Now he's not
right.
going to tell him to implement it, but he's gonna at least say, "Hey, this is what we need to do." It really is, and I think
Yeah.
that's key. But you get a lot of people who and you going back to the 4 o'clock meeting. Sometimes CEOs get their schedule so wrapped up that they can't take time to figure out what the organization's doing.
Mm. Yeah. And I think about it, that's where loyalty comes in. Just because you don't like the decision that leadership's making, or your colleague or whatever it is, you understand that you don't make all the rules, and you got to still ride with it. Now,
Well,
I
even
want to touch
CEOs
on
have
some.
to make all the decisions. Like, for example, a CEO has a board, so that's their constituents. So you really have to make sure that what you're doing is in concert with your board. Like investments, for example, we
Shareholders.
have lots of investments, so we have an investment committee. Well, you don't want the CEO, one person, setting aside that, hey, I think we need to invest more into fixed income. You want to, if that's their decision, let them make it.
Yeah. Yeah. And you always seem very in tune with what's going on. I've been a part of meetings with you and various people. But what's interesting is what you said before about your approach for the facility, which is growth. And it seems like there's a lot of people in rural facilities that come from a scarcity mindset rather than a growth mindset. You recognize your limitations, but you still need to grow. You've actually implemented some sort of, explain this to me, medical education in your facility. Uh, Tell me about that. Is there a residency program?
We were a 99-bed hospital, and basically we could not recruit docs because we were in a rural area, and most teaching programs are in metropolitan areas. So I was looking around, and I remember when I first got here, I was going to try to get a doctor's appointment to establish care. I got here in August, and they told me my first available appointment when I'm the CEO was January. And I said, well, if you're telling the CEO that his first available appointment is January, you're probably telling it to all the other patients. So we're never going to grow. So
Yeah.
tried to recruit, couldn't find it. So I remember sitting around thinking, well, I bet we could teach. So we started out with a family medicine residency program.
Mm.
And the strategy to me was just, I think it was just good luck. So we started out with a family medicine residency program. And then we noticed that all the people, family medicine people came in with mental health issues. So we decided to add a psychiatry teaching program. So our second residency, which has uh, 12 residences, is psychiatry. Well, also comes with family medicine is OB. So we decided to add an OB residency. And then the other area that we decided was to add a general surgery residency program. And people always say, how'd you do it? And I've got a famous word. I said, well, why not Motri? Why can't we do it? Because the doctors, if you think about a metropolitan area that's producing it, uh, they're producing, but those doctors are going to eventually, some of them are going to come back to a rural area. So that's really the best setting to teach them is in an area that they're going to practice medicine.
Yeah. Yeah.
So we took a 99-bed hospital, which everybody else had, a lot of people had teaching programs, and we established 4 actually residencies. And now we're at a point to where we're not hiring them, but we're putting them out in other parts of South Georgia to work. And here's the great philosophy behind that, Pedro, is the fact that if you got a family medicine residency program, they're used to the specialists that they've worked with for the last 3 years. So if I put a family medicine doc over in Tifton, which specialist do you think they're going to refer to?
Yeah. Yep. The
So
person that
then
they're
you
comfortable
start
with.
in migration. So you've got what you have here, and they're going to certainly use your docs. But then if I can plant other docs to other areas in South Georgia, it's going to serve as a referral source right into my hospital. So now we're from 99 beds 10 years ago to where we moved up to 155 bed hospital.
How many other hospitals of your size are doing something like that you know of?
There's not a rural hospital that I've ever seen that had 4 teaching programs.
Yeah, that's wild. But it goes along with the same philosophy of when I was speaking with you, I was bringing in an orthopedic robot, which was, new. And to your point, you saw the vision. If I have this, I'm going to attract this particular surgeon and some others in the future, right? If you build it, they will come, sort of thing, as opposed to a scarcity mindset.
Well, it's almost, and Ameko's a good example, but the Da Vinci robot, and I don't want to commercialize it, but you got general surgery, you got OB, and you got urology all using this Da Vinci robot. And they're trained at their programs to use that robot. Like the general surgery program we've got, those residents actually train all the time on that robot. So if they've been trained on it, what's the chances that they're going to go to a hospital that doesn't have a Da Vinci robot? So the
Yeah.
first checkbox is, do you have the technology that I was trained on?
Yes, 100%. And now you're taking it to the point where it's like, where did you even train?
Or is you
Here.
like when I'm recruiting doc, one of the first things I tell them is the fact that you tell me what kind of equipment you want. I put this in the contract. You tell me what kind of equipment you want, and I'll put it in the contract that I'll buy you that.
Mm,
So they know because they're making a decision when they're in their PGY 3 or 4, where they're 2 years out, like Dr. Davis came 2 years out, but they know they made a decision. They're going into a rural hospital that has the technology. Because the biggest downside to going into a rural hospital is, am I going to have to go back to doing open procedures? Am I going to have the technology that I was trained on?
yeah.
Convince them that if we already have that technology, it's even better.
Yeah. Make the investment for the non-traditional, the things that are attracting not only patients but the doctors as well.
Kind of like the med school that we've got. We got the Philadelphia College of Osteopathic Medicine, which is a 4-year med school. They were looking all around us at sites, and they were on their way back to Atlanta. And I called them up and I said, "Why not Moultrie?" I said, "Because if you look at Moultrie, you got Tifton, you got Thomasville, you got Albany, and you got Valdosta within 45 minutes. Your students can only travel 45 minutes. We're the ideal spot for you." And I remember the president of PCOM saying, "I hadn't thought about it." So sometimes you
Love
just
it.
got to tell the story.
Love that. Why not Moultrie? I think that's the theme of this podcast here. Why not Moultrie? I love it. Yeah. So with that, if there was a piece of advice to give to other rural healthcare leaders, whether in Georgia or throughout the country, I guess it's, building something that attracts people to you and being mindful of what not having that scarcity mindset, not being afraid of loss, but where can you grow? What is it that's going to make you have differentiators?
And I tell you, it's a little more, and I like what you just said,
Mm-hmm, mm-hmm.
but let's peel the onion back.
Okay.
look at your data and find out what is going out of town, what's your out migration. And if you've got enough of that volume that's going out of town, then why not bring it in town? For example, radiation, right? When I looked at it, I was sending 160 cases a year out of town for radiation therapy. Well, my break even's 125 cases a year. So if I can add that to my modalities, then that population will stay here.
Yes.
So that's how I decide what I'm going to add is I look and see what's going out of town. And then because sometimes you want to add something that's pretty, but there's not enough volume. For example, robotic prostatectomy. There's only 16 cases a year that go out of town. And so everybody says, why don't you recruit a urologist that does robotic prostatectomies? Well, if I've only got 16 cases in the county and I've only got 39 cases in the region, I'm not going to get that volume. So I don't need to spend a lot of time doing it. So I think you have to look and see what's going out of town and is it enough to add that modality?
Right. That's a great point because your community, the people that you serve, is generally fixed, right? There's a certain amount of people. What kind of procedures do they require? Let's capture that, right? And what are the chances somebody from another county is going to come over to yours and skip past the hospital?
I
Are
think
you?
you got to do about a 30 miles outside your county type radius
Mm-hmm.
because people will travel about an hour for care. But if it's specialty care, that's where the big tertiary care is because they're going to go there. But so I think you got to take what's that population doing in your county and about 30 miles outside your county.
Got it. Got it. Well, that's great. I mean, that's a. Let's see here. I'll pause for a second. So far, great. I'll clip this part out. Is there anything you want to touch on or not? How are we doing so far? How are you feeling? We're at
We
one.
got time. We got time.
Cool.
I'm enjoying this. So
Awesome.
uh, I don't know. I mean, I guess the biggest message I always like to talk about is the fact that I think people people poor mouth rural hospitals more than they should.
Mm,
For example, once you've purchased that piece of equipment, the cash is out the door. So people look at net income, which is after depreciation. Well, depreciation is not a cash flow item. So start calculating your performance based upon your cash flow, not based upon depreciation and stuff that you don't have. And once you start looking at your true EBITDA, which is earnings before depreciation, interest, and taxes, once you start looking at that number, that's an entirely different number
mm,
because then you know how much cash you got coming in and how much you got going out.
right.
But and the problem that a lot of rural hospitals they do is they poor mouth it. Well, like we're doing bad, we're struggling and all that. Well, if you're a patient, do you want to go to a hospital where the CEO's got on uh in the paper that we're doing bad?
Yeah,
No.
you're
So
right.
make it positive as possible and quit poor mouthing it.
Yeah. That goes with momentum too. Any organization requires momentum. I mean, the numbers are the numbers and those are the facts. But there's also the sense that the community gets about how things are going, right?
They want it to, they want to know you're growing.
Yeah. Yeah. Because when the chips are down and they're not doing well or someone that they love, they want to make sure that they're going to the right place. So you have to make sure that you're providing and also informing them that this is the place to be for these specialties, for these things that we provide. I see that. As a rural.
With that though, is that you got to make I I went to the Disney experience once, where you notice if you go to Disney Park, it's clean. There's not, you can't ever find a piece of trash. People speak to you and all the time. Well, that's the same way I run a hospital. Is the fact that we have this rule, which I call the 10 and 5 rule, which is when you get 10 feet away, you have to make eye contact, and you're 5 feet away, you have to speak. And
Ooh.
I tell employees that you got two chances. First time, you got to buy me lunch if I catch you. The second time, you self-select out of the organization. And people say, "Well, what does that mean?" I said, "You just lost your job." And it sounds horrible, but why should you want somebody to work in an organization that won't say hello to your patients?
Mm,
And I even go so far to put it in every single employee's orientation, and all my physician contracts say that you have to speak to people when you're 10 feet away, or when you're 10 feet away, you have to make eye contact and you have to speak. I put in my physician contracts when you go into a patient room, you got to sit down. And it's that level of detail that changes it. And that's why we hit the 95th percentile on Press Ganey for customer service.
wow.
It's making sure that you've got the steps in place to make sure so that when that patient does try your hospital, it's a positive experience.
Yes. Yes. That's a masterclass right there. I've worked with some younger reps, and we've gotten into discussions about what do you say and what don't you say? What do you ask? What don't you ask when you're meeting with a customer? And I always preface it with the chances are after the meeting, everything that was spoken about is going to be forgotten except for maybe a point that you really drive home. Otherwise, they're going to be left with a vibe, a sense, a feeling of how you made them feel. Did you make them feel confident? Did you make them feel good? Did you make them feel unsure? How they feel is how things are going to progress. So do what you need to do and say what you need to say so that that feeling that the customer has after is the one that you want. And that's exactly, in my opinion, is what you're doing there is you're making your employees are making the choices that give the people the feeling that they're going to say, I like it there or I don't like it there. That's huge. I like that a lot. The 10 and 5.
Picking up trash. I mean, for example, one of the other must-haves, we call them must-haves, is picking up trash. I hope every day that when I walk from my car to the hospital, there's an opportunity for me to model picking up trash in the parking lot because they see the CEO picking up trash. Because a lot of CEOs, and I've seen this time and time again, would pick up their phone and say, "Hey, maintenance, there's some trash outside the hospital, but why not just go ahead and pick it up yourself?"
Yeah.
Uh, if you go by a trash can and it's full, well, there's always bags in the trash can. You know, they always keep it set up.
Yeah.
Trash out, take it to the dumpster, and it's those little times, those nuggets that if you do that, somebody sees it, somebody's going to remember that.
Yeah.
I saw the CEO taking the trash out for God's sakes.
Yeah. If he's doing it, then we all should be doing it. So I've made this point before, and I'm not sure if I mentioned it to you. I'm curious what you think about it. That one of the issues in healthcare is it's no one's fault. It's the natural order of things. People enjoy or people try to get promoted and move to the next level and are trying to achieve and go from this facility to this facility because they made a step up in their role, in their position. And when that happens often, and that's happening a lot, initiatives change because, oh, that was the previous person who was in this position. That's what they wanted. But now this person's in charge. So they're now going to change what they want. Do you feel like that is potentially an issue at sites in, I would say, major cities where there's constant changing and moving? And this is the new person. 2 years later, it's the next person is the COO and the next person is the head of this. Would you agree with that is a problem or could be a problem in our world?
I think it's a mistake the CEOs make. They come in and they decide they want to get their own team in there.
Mm,
And all you've done, and I know a hospital where they came in and the CEO let the chief operating officer go, let the chief financial officer go. Well, when those new leaders come in, they let their directors go. Those directors let their employees go. So everybody's insecure. So, and job insecurity is to me is paralyzing. So I think a good leader will take their team, like I said before, do an inventory and make sure if they're in the right place, improve on it. But for God's sakes, don't fire anybody. Don't let anyone go because and what I always like to do is when I first walk into the organization is I give them what we call a stay on bonus. Okay, if you'll stay with me for 2 years, I'll give you this bonus because I want you to
mm,
see what I'm going to do. Because I can take what I have and work with it better than I can teach a new person to do it.
interesting.
But
That's right.
the go-to is lots of times, "Hey, I've got this guy that can do this better." Well, how the hell you know that? So take what you got and develop it because most people got to those positions because they were successful.
Yeah.
Most
Yeah.
people got to be a chief operating officer, a chief financial officer, or director of the lab because they had something in them. So rather than replace it, take that and grow on it.
And they also have a pulse of what's going on. They know the people, they know the vibe, they know some history, where things are going, and you can get a sense from them. It's taken from the private equity book too. You know, people who these guys who buy businesses, grow them, and leave them. They try and keep the same people in place, and they'll throw bonuses at them. Hey, if you stick around because you've been here,
There you go.
we need people who know what's going on. Because the onboarding experience for anyone in a new role takes time to get familiar. I agree with that.
You know, I did think leaders, and I remember when I replaced Jim Lowry, he had been here 40 years.
Mm.
Uh, you know, he's got a lot of loyalty to him. I don't need to come in and disparage him. I need to really build him up as that he built a very good foundation, and we're going to grow on that foundation because if people know that I'm going to, and best example was I invited the previous CEO to attend a lot of the meetings before, and I met with him monthly when he retired, met with him monthly to kind of give him an update of what's going on and see what he would think. Well, then he became my biggest ally because he would go back and tell the people, hey, Jim meets with me to find out how this strategy would work, how we did that. So now I've all of a sudden got an ally in the previous CEO. But a lot of people just don't want anything to do with the previous CEO. I would tell CEOs, if you come in and replace somebody or a drug rep, if you're replacing the other drug rep, manage that other drug rep up as
Yeah.
positive because then you're managing the organization he works for up so that you can just build on it. But if you go in and say, yeah, he missed a lot of appointments or he was late and all that, all you've done is made a negative situation. So
Right.
I would tell most of your vendors, if they come in and replace another vendor, the best thing you can do is brag about that previous vendor.
I like that. Yeah. I mean, you see things like resources, leverage, networking, utilizing. I'm keeping that one. That's good. Now, when it comes to outside of work, when you're outside of the office, how much work are you doing still for Colquitt Regional? Are you going out and meeting with certain people and golfing and finding people to donate to the facility? What's that side of life like as a CEO, outside your office?
I think when you're a CEO, you're always on.
Mm-hmm.
And I tell this to my twin brother. Tim, when you're going to the store, make sure you got a collared shirt on, you got khaki pants, because you are the image of that hospital. Because I remember when he came to visit with me, we went to the store, he had an old t-shirt on and some blue jeans, and I said, no, you can't wear that. So you're always on. So you do have to do a certain amount of that. Now you got to spend time with your family too,
Yeah.
but but you can have a balance there. Like when I go out to the local restaurant and I'll see somebody there, like an employee, I'll make sure I pick up their dinner or their lunch and pay for it so that we've got it. So you have to do that. Now you got to balance it. So I always say that when I get off between 5:30 and 6, I try to shut it down by I'll give 30 minutes to kind of finish my thought process. I'll try to shut it down. But then I still take the calls or stuff, but I don't text and I don't email after 6 o'clock. Now I'll answer one that's important. I might look at it, but I've got to have work-life balance to where I have to shut it down.
Yeah. Yeah. I can imagine. So if you're a Colquitt Regional employee, follow Jim around to wherever he eats and you'll be getting free food. That's what I heard.
Free food. Exactly.
That's for everybody out there. I like that.
But one of
Um,
the things that I do, if you look at my business card, I put my cell phone on it for everyone in the community and every single employee to have. And it's never been abused, but then they know they have access to me. And it's so easy. And you might get one person that's crazy where you have to block them, but most people are very cognizant of the fact that let's don't call him unless we really need it.
Right.
But it goes back to that access. You got to make sure that you have access, that people have access to you, and that people have access to the facility.
It's like an open door policy. People won't abuse it. That's a great point. I love that. Well, those are the questions that I have for you. I've gotten more out of this than I ever expected. This is great. Are there any final points or anything that you want to share on your end about you and Moultrie, Colquitt?
I think the one thing, and I would even tell you that if you've got vendors that got promoted to the vice president, now they got multiple vendors that are reporting, is don't let it go to your head. And I always call it vice president-itis. Okay, now you're a vice president, but you got there because you did a good job. Don't let the fact that you're in a role go to your head. Keep it simple, keep yourself humble, and always kind of treat people very good. The best story when I was 21 years old that I tell was I started out in the hospital and I was a staff accountant, and my mom worked in the housekeeping department. And I remember not treating her good. I remember thinking, that's the housekeeper. And she brought me home one day and she said, Jimmy, I raised you. And I don't like the way you're treating me. And, you're disrespecting me. I was so humbled by that. And I was so glad I was 21 years old that I learned that lesson good, is the fact that I really feel that the best thing you can do as you move up or as you move around is keep yourself humble, and everybody matters.
Mm-hmm.
Everybody matters. Most people won't walk into the CEO office unless they've really got something they want to talk to you about. So take time to listen. Now,
Yeah.
some of the things aren't that I can't handle and I can get them in the right place, but keep yourself humble. And if you're humble, people will like you. If people like you, you'll move up.
Wise words to live by. And I appreciate your time from the moment you let me into your office and meet with you to this day. So as you know, if there's something that you need from me, I'm here for you, and I'm super grateful to have you on. Thank you for your time.
I enjoyed it.
Thanks for watching. Don't forget to click subscribe so you don't miss an episode. And remember, if you or a friend want a job in medical sales, the best place to go is medsalesblueprint.com.